Manitoba's top doctor is calling this a daunting time for the province. Hospitalizations for COVID-19 are at an all-time high. New cases and deaths are both climbing at an alarming rate, and there is new concern for some communities and people most at risk. Province-wide, Manitoba has reported more than 3,100 new cases of COVID-19 since last week. And the number of lives lost in that time is greater than at any time for the entire rest of the pandemic. Out of those latest new infections, more than 200 of them are among Manitoba's First Nations people, and active cases of Manitoba First Nations make up nearly a fifth of the provincial total. So for more on the toll the pandemic is taking on First Nations communities in Manitoba, we're joined by Dr. Marcia Anderson, who is leading Manitoba's rapid response teams. We reached her at St. Andrews, Manitoba. Dr. Anderson, thanks so much for joining us. Let's talk.
Good morning.
Good morning to you. Let's talk about First Nations communities in Manitoba and the high risk that they are, the imminent danger really that they're under in terms of becoming infected with coronavirus.
Mm-hmm. Yes, thank you for that. You know, one of the first points I'd like to let the listeners know is that this is impacting First Nations people both on and off reserve in rural, remote areas and in urban areas. And so it's not actually just in the First Nations communities, it's First Nations people across the province. And we are consistently seeing higher rates of new cases, higher rates of hospitalization, and higher rates of admission to the intensive care units. So we are very concerned about what we're seeing and what we might see in the weeks and months to come.
There has been a lot of attention on some of the underlying causes on this, but if you could just underline for us what has created the conditions that is resulting in these sorts of numbers.
Thank you for that. The conditions that are creating these sorts of numbers are the same conditions that lead to higher impacts from influenza every year, from H1N1, and even going back to the Spanish flu. Really key drivers are things like inadequate and overcrowded housing with poor ventilation, food and income security, chronic impacts of racism, and how all of those impact both the acute infection with COVID-19, but also underlying chronic illnesses and contribute to higher rates of underlying chronic illnesses like hypertension and diabetes and underlying lung disease that make the risk of severe COVID-19 worse.
As you say, we have seen these conditions on reserve and in the urban environments as well. But there has been, not only in Manitoba, but of course in Nunavut as well, concerns over remote communities. So you're helping lead the rapid response teams. What can you tell us about the resources that are being put in to assist those communities?
Yeah, so our rapid response teams are collaborative of the Manitoba First Nations Pandemic Response Coordination Team. They are nimble teams of different types of health professionals, including physicians, nurses, rehab specialists, that we can deploy often within 48 hours to a community where the COVID case and contact management is not going to be met by the team on the ground. And of course, in a remote community, it's not as easy as redeploying people from one health center or hospital to another. So our teams have gone in order to implement testing and do quite widespread testing, often using rapid testing devices, and to support the local team with the case and contact management in order to quickly contain clusters of COVID-19 and try to minimize any morbidity or mortality.
When you say quickly contain, though, what are the challenges around adequate healthcare facilities, transportation, this kind of thing?
The transportation challenges are actually a major one, including getting people from their homes to a testing site. But then also isolation and appropriate isolation is critical to interrupt the transmission of COVID-19. And some of the remote communities, we're talking about both transfers over water and air in order to have people placed appropriately in isolation. So it can be everything from picking the person up and getting them to the testing site, to getting them to alternative isolation, which is safer, or of course for acute medical care if that becomes necessary. And that becomes even more of a concern as we enter the winter season with the well-known weather challenges that can really impact those transfers.
From the very beginning, again, in the remote communities, but on reserve right across this country, there were red flags raised. The numbers initially seemed to be contained. Now we seem to see an increase in those numbers in so many locations. Can I ask you for your assessment of despite the efforts that are being made, and you and others are making, your assessment of where this could be headed in terms of First Nations communities right across this country?
So as community transmission has increased dramatically during this wave compared to the first wave, where there was, at least in Manitoba, a lot more travel-related cases, we will continue to see these higher rates in case numbers. And of course, all of us are concerned because of the higher rates of hospitalization. Unfortunately, in the past couple of weeks, we've not only reported more deaths in Manitoba than ever before, but also in First Nations people. Last week, for example, we reported 7 deaths in First Nations people in Manitoba. And so we worry, of course, about the direct COVID-related impacts, but also the cumulative grief that brings to communities and impacts on mental and emotional health and well-being as well.
Is there anything in terms of either advice or reassurance that you can provide to First Nations people in Manitoba dealing with this awful pandemic?
You know, in terms of reassurance, what I would say is we have been working really well and really collaboratively with community leadership who are being so proactive and showing that care and concern for their communities. I would encourage all First Nations people to strictly follow the public health orders, both provincially and that their communities may put in effect. The staying at home as much as possible, except for essential workers, is the most critical action we can all take right now. And then when additional resources are needed, whether it's our rapid response team, whether it's the support of the federal government or other supports needed, we will all work together to do our best to respond and meet those needs.
Dr. Marcia Anderson, I want to thank you so much for your time, and I want to wish you the best of luck in your efforts. Thank you.
Thank you very much.